Medicare Parts A and B are very good foundational pieces to your healthcare and retirement, but supplement plans and advantage plans paired with them don't cover everything left over either. Welcome to Building Blocks, a special health and retirement series. My name is Trey Basa, a licensed health insurance advisor with Market Medicare Advisors. Here on Building Blocks, I aim to build your foundational knowledge of everything Medicare, just one block at a time. Today's focus will be entirely on enrolling into Medicare. It's very important to get the timing right to avoid any penalties or setbacks to your retirement plan. In just the last episode, I sat down with Corey Hebert to talk about all of these different enrollment periods, but we didn't touch base on how to enroll into Medicare, and that is today's first building block: automatic enrollment into Medicare when turning 65. As you see, if you are drawing Social Security or a Railroad Retirement Board check before you turn 65, you will automatically be enrolled into Medicare. And a lot of people get caught by surprise whenever they get their Medicare card in the mail. They say, okay, well, I guess it's time. But that's not necessarily the case. If you are drawing Social Security or a Railroad Board retirement check before you turn 65, you do not have to start Medicare Parts B. We recommend keeping Part A. It just gets your foot in the door, gets you in the system and a Medicare number, but you do not have to take Part B because Part A is $0 and Part B does have an annual premium. That premium will be automatically deducted from your Social Security check or your railroad check. If you do not want to start Part B, if you do not want to start paying that premium, all you have to do is just sign on the back of your card and send it back to the Social Security Administration. That will disenroll you from Part B. Now, it's important to note when you do start Part B, a very delicate timeline starts. You have a very limited amount of time to get X, Y, and Z started for your additional policies. Remember, in the past, we've talked about how Parts A and B are very good at doing what they do for Medicare, but they don't do everything that you would need. That's why we pair it with a supplement plan or an advantage plan, and getting into those plans starts when you start Part B. That timeline is just already on its way. Our second building block today is manually enrolling into Medicare when you turn 65. Perhaps you want to roll up your Social Security benefits. You want to put it off until your full retirement age. You can do that, and you can start Medicare Parts A and B. All you have to do is schedule an appointment with the Social Security Administration, either in person or on phone, or, and I highly recommend this, going to ssa.gov, making a login, and filling out the application online. From what my clients have told me, it is the exact same questions they'll ask you in office that are online in that application. It's a very straightforward application, maybe 10, 15 minutes with all of your personal information. The Social Security Administration just wants to make sure you know you are who you say you are. You're not applying under anybody else's Social Security number. The biggest catch, people always try to go to Medicare.gov to apply for Medicare Parts A and B. I know it makes sense, it really does, but that's not how they've set it up. Technically, your Medicare benefits are going to come from your Social Security benefits. Remember in the first building block how I was talking about Part B premiums coming out of that Social Security check? Well, if you're not starting your Social Security, you still have to apply for Medicare through the Social Security Administration. And then they're going to send you a bill. They're going to send you something in the mail saying, hey, you have to pay for 3 months of Medicare Part B premiums through the mail, or you call in and pay, set up those payments online, maybe through Medicare.gov. But again, everything gets started through the Social Security Administration, whether you're starting your cash benefits for Social Security or not. After you apply manually, then it becomes a waiting game. You have to wait for the Social Security Administration to process your paperwork, send you some mail, and then you get your Medicare card Medicare number, effective dates for parts A and B, and you use that information to enroll into everything else. The third building block today is manual enrollment after you turn 65. Something that comes up a lot with folks is that they want to build up their Social Security, or perhaps they want to continue working, whether it's to keep workplace insurance or to keep their spouse on workplace insurance until they're eligible for Medicare. If that is the case, you can sign up for Medicare past your 65th birthday. But I have to note, you need to make sure your workplace insurance counts as creditable coverage. A representative from your HR department should be able to give you that information. Make sure it meets this level of Medicare, because when you go past 65, you will have to prove that you've had creditable coverage for all that time when you could have been on Medicare. In order to prove that you've had creditable coverage, you have to fill out two forms, the CMS 40B and L564. Filling out those forms is going to provide the government the information that they need to double check that you've had credible coverage past the age 65. Another hoop to jump through, but it is necessary to avoid any penalties that might accrue between 65 and when you actually move on to Medicare. When you fill out these forms, we do recommend faxing them in, because again, it is going to be a waiting game. The fax just lets us know that it gets to their office directly right then and there, but it might not be processed right away. So faxing them in is highly recommended on my behalf, because this is something that I do with clients year round. Folks that put off Medicare, that put off their Social Security benefits for a couple of years. We fill out the forms, we send them in by fax. With these building blocks of information, we here at Market Medicare Advisors sift through all of the plans in your area. All of these hoops that you have to jump through to give you a better understanding of the grand plan for your health in retirement. Everything from your supplements to Medicare Advantage to ancillary products, these are policies that have a very particular timeline to follow when signing up or even executing all of these forms and enrollment processes. At the end of the day, we're here to help. So, if you have any questions about your ancillary Medicare supplement, your timeline for signing up for Medicare, or perhaps you're just curious if there's anything out there that you might not know and want to learn a little bit more about, please feel free to give us a call at 833-MAG-REPORT. That's 833-624-7376. Or you can email us at mail@marketmedicareadvisors.com and connect with us today. That'll be it for today. Be sure to subscribe and stay tuned for more videos just like these for all your Medicare needs. Don't forget to like and share so you can help your friends and family by getting them the information they need to know about Medicare. You can catch this show and our entire catalog of shows on our channel, youtube.com/@retirementhelp, where we archive all our previously recorded and aired episodes, where I and other retirement professionals come together in one place to talk about how we're actively working with clients today to prepare them to live their best lives in retirement. I've been your host, Trey Basa. Thank you so much for joining me here on Building Blocks, building your Medicare knowledge one block at a time. I'll see you guys in the next one.
Unless otherwise indicated, all client and prospect names mentioned on this show have been changed to protect the identities of the individuals discussed.
The content provided is intended for informational and educational purposes only. The views, statements, and opinions expressed herein are those of the individual speakers. This is not endorsed or affiliated with any U.S. government agency, the Social Security Administration, or associated with any federal Medicare program. We do not offer every plan available in your area. Any information we provide is limited to those plans we do offer in your area. Please contact Medicare.gov or 1-800-MEDICARE to get information on all of your options. Investment advisory services are offered through Foundations Investment Advisors LLC, an SEC-registered investment advisor. All rights reserved.